This bill is an option to provide health insurance to low-income residents of North Carolina under a new product offering known as Carolina Cares. It directs HHS to design a program for residents who are not eligible for Medicaid under the current Medicaid criteria. Here are the key criteria. The resident's modified adjusted gross income does not exceed 133% of the federal poverty level. The resident is not entitled or enrolled in Medicare Part A or B benefits. The resident is between age 19 and no older than age 64. The resident must be employed or engaged in activities to promote employment. And there are a few exceptions to mandatory employment, but are very limited. Those include the resident is a veteran in transition but actively seeking work, is a member of a federally recognized tribe, may be medically frail, or have a financial hardship. Second, and a major difference which makes this unique and different from other states, routine Medicaid, or even most insurance products, is that the participants must make certain commitments which focus on preventive care with a wellness emphasis. For example, the resident who qualifies and elects this insurance option must agree to participate in routine physicals, routine screenings such as mammograms, colonoscopies, weight management programs, routine dental, to name just a few. And these will be defined as medically appropriate to fit the health needs of an individual participant in more detail as we get into the designing of the bill. This is an option. It's not required. It's designed like many insurance products. Participants who fail to keep up with their premiums or coverage requirements lose coverage. This product is unlike any other state in the nation. It establishes a new health care paradigm in North Carolina rooted in consumerism and personal responsibility. Now let's shift to the very important question. How will this plan be paid for, and will there be any new North Carolina taxes used to pay for this option of care? You've already heard that the resident who qualifies for this product will pay for a portion. The participant will also pay co-pays. In addition, federal funds will be identified to the maximum allowable as we negotiate and work through our waiver request. The balance of the costs that are not covered by federal funds or participant contributions will be funded through health care related assessments, including but not limited to hospital assessments. Now let's just drill down a little more, since one of the biggest concerns by many lawmakers is funding. And are we taking on a future liability? Uninsured residents are more likely to delay seeing a doctor and then go to one of our state's emergency rooms when their illness gets worse. Because many of these uninsured lack adequate resources to pay, the providers, be it the hospital or the doctors, absorb the full cost of care. This cost is then passed along to individuals with insurance through higher premiums, often referred to as cost shifting. Cost shifting is a burden cost, or some think of it as a hidden tax, which adds the provider cost of uncollectible care over to those who do not have insurance, who do have insurance. So each of us that have insurance, we have a portion of our premiums that we pay for the uninsured. This cost shift adds hundreds of millions of dollars to the private insurance plans. Uninsured residents know that the emergency room is one safe place that they can go for care, that can't ask for money up front, and they must be treated. North Carolina actually saves money. And I want to focus on it. North Carolina will actually save money. Yes, save money under the traditional Medicaid program. If this new option were implemented at no cost to North Carolina and our North Carolina taxpayers, the traditional funding formulas with our current Medicaid plan would decrease by approximately $45 million on an annual basis. Fiscal Research has done a conservative forecast which nets this level of cost savings to traditional Medicaid. As noted earlier, our ERs are often clogged with the uninsured patients seeking care. Uninsured residents cost North Carolina in a variety of ways under current Medicaid formulas. This annual cost reduction of $45 million is a function of how our current payments work to providers for their uninsured care and disproportionate ratios. Now, I know this is a rather complex formula, but rest assured the fiscal staff are very skilled in Medicaid payments and, again, estimate the savings to the state $45 million annually. By providing coverage to the working low-income worker, demand for healthcare services will increase. Economic growth by creating new healthcare sector jobs to treat the newly enrolled beneficiaries who will be required to seek routine preventive services. This influx of healthcare services will benefit rural areas of North Carolina where many providers are already under a great deal of stress. These services, once provided primarily in our emergency rooms, will now be shifted to more appropriate levels of care where people will be taken care of. Studies show persons with health coverage, they see the doctor more routinely, they take their medicines, they report better health, better financial stability, and less time away from work, and lower mortality. Now let's shift to federal funding to support this innovative insurance program. First, Medicare, and I'm make sure you understand Medicare, not Medicaid. The federal Medicare payments to providers were cut to a significant degree as part of the federal funding to support each state's initiative. According to our North Carolina hospitals, Medicare payments have already been cut or reduced $900 million to our North Carolina hospitals. Future cuts are estimated at $800 million each year for the next 9 years. Now, as a former hospital CEO of a large academic medical center, these types of cuts are devastating and often lead to cuts in services and employee downsizing. These funds, through the cuts, are not now coming back to North Carolina. Under our proposed model, these funds will be flowing back to North Carolina through the federal support that we anticipate. In summary, this optional coverage requires participant contributions with a work requirement, will result in no state funding or accepting no new liability, but will realize an estimated annual ongoing savings of $45 million under our current funding obligations under the traditional Medicaid plan. The newly insured wins via better health care, the state wins with a net reduction in cost, and providers win by receiving new payments for historically high levels of free or uncompensated care, and the Medicare cuts that were imposed on them will be redirected back to North Carolina. This plan is a win-win-win for all involved.